Hi, this is Dr. Justin Marchegiani here, and I'm going to start tonight's talk out with a question. How much blood sugar do you think is in your entire bloodstream? Again, I guarantee you if you're honest with yourself and you check the answer at the bottom, you're going to find you were probably way off. So let's break that down and make mathematical sense of it for you. So again, we're typically, have 100 milligrams of blood sugar, 100 milligrams per deciliter of blood sugar in our body, right? If we have diabetes, we typically have 126 or above. If we have metabolic syndrome, we start to go above 110. So just to keep the numbers nice and round, 100 is usually a decent blood sugar. I like between 85 and 95 personally. But when we use standard deviation, where we knock off all of the different metrics to the right of the number, what you're going to see is this. We knock out milligrams, we knock out deciliters, we knock out liters, we knock out 3 zeros on the bottom, and then 3 on the top to balance it out. 1, 2, 3. We're actually left with 5 to 7 grams of sugar. Essentially, 1 teaspoon of sugar is in our entire bloodstream at one time. And again, normal amount of blood is about 5 to 7 liters, so that could be up to 7 grams or 1.3 teaspoons, if you will. But if we're looking at 5 liters of blood, 1 teaspoon. So next time you're making coffee and you're scooping in 2 or 3 or 4 teaspoons of sugar into your coffee, you just doubled or tripled or quadrupled the amount of sugar that's in your entire bloodstream. It's pretty mind-boggling when you think about it from that perspective. Not to mention, if you were to pull out a 12-ounce can of Coke that had 30 or 40 grams of sugar, well, you just multiplied the amount of sugar in your bloodstream by 40. And there's no wonder why we have all kinds of rampant obesity and hormonal issues and cancer. For instance, cancer is one of the main cells, one of the main compounds that cancer cells feed off of are glucose. Glucose is one of the main fuels for cancer. Not to mention high amounts of insulin, because of all this high sugar, actually deranges our hormones. It causes women to make more androgens or more testosterone-based hormones, and it causes men to be more estrogenic. So when our blood sugar and our hormones go out of balance, women become more like men and men become more like women. It's kind of like this cruel joke that Mother Nature plays on us. So we're going to kind of break down what's actually happening when our blood sugar goes high. So we'll show you normal physiology first so you can get a sense of what it should be like. So we have 2 molecules of glucose in our bloodstream. And if our blood sugar is balanced, that blood sugar is going to go into the receptor site. All right. We need insulin for that glucose to go into the receptor site. So if we're healthy, that glucose is going to go into our muscle cell receptor. The insulin will allow it to get sucked up by the muscle right in. And again, just for reference, your muscle can hold about 300 to about 375 grams of sugar in the muscle. Not to mention, glucose gets sucked in by the liver cell, gets sucked right up, and your liver can hold about 60 to 70 grams of carbohydrate or sugar in the liver. So you're looking at about close to, let's say, use a round number, about 400 grams of carbohydrate or glucose can be reserved or stored in our muscle and liver. And again, the goal is to be burning it here. All right, the goal is never to really be storing it. Well, we want to store it, but once these things are tapped off, as you'll see in the next slide, all of our glucose is actually going to get converted to fat, and I'll show you that in a second. So the goal is we want to have healthy, strong muscles, so we have lots of reservoir for our glucose, and strong muscles actually make our insulin receptor really sensitive to insulin, so we don't need as much insulin to help suck that glucose in. And again, if we're keeping our glucose levels balanced, the chance of these things becoming full and tapped out and our glucose getting shunted to our fat cell becomes less. So let's say we became more unhealthy. We're adding all these bad, inflammatory, nutrient-poor, toxic foods to our diet. We start developing insulin resistance. So what's happening here is our insulin receptor becomes resistant to allowing the glucose to suck into the muscle, into the liver. So kind of think about maybe if you're a kid and you ever pranked your neighbor's doorbell and you rang the doorbell and kind of hid behind a tree and kind of laughed as the neighbor opened the door and said, hey, there's no one here. Well, let's say you went back and did it 2, 3, 4 times. Well, eventually your neighbor gets the idea, hey, we got some kids out there pranking us. Let's just ignore them. They'll go away. Well, that's kind of what happens with insulin and glucose. These receptor sites become down-regulated. So again, the doorbell's ringing, and no one's answering. So our insulin receptors just numb to the fact that, hey, glucose is there. They keep on prank calling me, and or prank ringing my doorbell, and I'm just not going to open up. And that's the same thing that happens with insulin resistance. So if you understand that concept, you'll understand, why this is so bad for your body, because all of this glucose, if it's not going into the cell, the muscle cell or the liver cell, well, where's it going? Eventually, blood sugar in the body is going to increase. That's going to increase free radical damage due to advanced glycation end products. It's also going to increase insulin. Insulin's a growth factor for a lot of cells, right? If you provide too much growth factor, you eventually develop tumors or cancer. And it's also going to make you fat. So you're going to see these glucose molecules start going into our fat cell and making the fat cell bigger. And when we're obese, that increases risk factors for all diseases across the board: high blood pressure, cancer, heart disease, diabetes, etc. So this is kind of the dreaded physiology downward spiral that we see with these types of physiological imbalances. So let's take a look at what's promoting these imbalances in the first place. Well, if we're eating a lot of refined carbohydrate, junk food, gluten, grains, sugar, refined sugar and such, watch how fast that sugar goes into our bloodstream. As you can see, it just zips right into the bloodstream, and you get punctuated up and down spikes of blood sugar, which then stimulate insulin. And then eventually we get the whole numbing effect of the insulin receptor to the glucose. Now, if we're eating more vegetables like non-starchy carbohydrates, like your broccoli, your spinach, your Brussels sprouts and such, and maybe even lower glycemic fruits like berries, you're going to see a more time-release fashion. So you're not going to get that punctuated up and down of glucose, so you have more of a steady state of insulin, steady state of glucose. This is better for you. And then you can see when you eat proteins and fats, it's even more time released. You get a more, just a gentle buffer of that glucose going into our bloodstream. And yes, our body can actually produce blood sugar from proteins. It's called gluconeogenesis. And your body can actually use fats for fuel as well. That's called ketones or ketosis. And that's something we'll have to talk about on another talk here. But if you go back here just a moment, the goal really is to combine the non-starchy carbohydrates with the proteins and fats in general. Some people may be able to handle more maybe starchy carbohydrates, but in general, for a population that's more overweight, you're better off just combining your non-starchy carbs with your proteins and fats, and you'll get a much more time-release fashion, and you'll feel better, and you'll decrease your risk for nearly all diseases across the board, without a doubt. Hope everyone found today's talk really helpful. For more information about myself and my practice, feel free to check out the information bar below the video. There's contact links and how you can get a hold of me as well. And I hope everyone enjoyed today's video. Thanks. Have a great day.